Hi, I'm Claire Doherty, CEO of Brem Foundation to Defeat Breast Cancer. We're so thrilled to see all of you here with us tonight for what will be, what we hope, a compelling and educational program. While the content tonight is really targeted at younger women and people of pre-screening age, to be honest, the information that we will share will benefit everyone who cares about both their own breast health and the women in their lives. You may have heard recently, studies are showing increasing rates of cancer diagnosis in younger women. We've seen this clearly play out in the very public announcements by actress Olivia Munn and Kate Middleton. In fact, just on Monday, Dr. Brem shared with me a study released in Canada showing a 46% increase in breast cancer incidence among women in their 20s in recent years. Unfortunately, younger women, and particularly Black women, are diagnosed with the more aggressive, hard-to-treat cancers, including triple-negative breast cancer. It's unclear what's driving this troubling trend. It's likely a mixture of factors. And while researchers are looking for those answers, and until we have a better understanding, learning about your individual risk factors and early detection is more important than ever. Our speakers tonight will tell you in their own words why taking charge of your breast health and advocating for yourself and your loved ones can make all the difference. Before we really kick off the program, I want to spend a little bit of time telling you a bit more about Brem Foundation and our focused approach to early detection of breast cancer. We do our work through three core pillars: education, access programs, and advocacy. Our education programs teach people about risk factors and about personalized screening and how to advocate for quality care. You are taking part in one of our educational programs this evening. Our access programs are built on deep partnerships with local community healthcare providers to both pay for the breast cancer screenings and transportation for underserved in our communities. And finally, our advocacy work centers around opening access to breast care, both on the state and federal levels, to ensure that it's available to all people, regardless of an ability to pay. Part of our advocacy work is to push back when women's breast health isn't being adequately served. Last week, you may have heard the news about new breast cancer screening guidelines that were finalized by the United States Preventive Task Force, which is the medical body tasked with making recommendations about when women should get mammograms and other screenings. This is the first time they've made a final update since 2009. And while they did take a long overdue step in recommending that women of average risk get annual mammograms starting at age 40, which is a long overdue change from age 50, Brem Foundation was disappointed in these final recommendations. We feel strongly that they failed women on a number of fronts. First, in not recommending annual screenings, they recommend biannual screenings. In not effectively addressing existing disparities through earlier risk assessment, and not recognizing the importance of additional screening beyond mammography for women with dense breasts. USPSTF can and should do better by women, and Brem Foundation will continue to use our voice to advocate for breast health for all women, working to detect early and save lives. I want to give a heartfelt thanks to our incredible lineup of speakers that you'll hear from tonight. Dr. Margaret Hauser, Daria Ross from the Tiger Lily Foundation, Perla Rodriguez, and Ali Rogan. I cannot wait for the program and all the knowledge that is about to be shared by this stellar group. And stay tuned for a special appearance by Cassie Ballou, Miss District of Columbia, USA, who will give out some awesome prizes to 5 lucky attendees. Finally, a big thank you to the wonderful collaborator organizations you see here on this slide. We are just incredibly grateful for their partnership. They showed up and were instrumental in helping Brem Foundation reach so many more people with tonight's programming. These fantastic organizations create real impact every day to push back on breast cancer and are creating a healthy, more equitable communities for all. And we're honored to partner with them. Before I turn the program over to Athena Jones, our incredible moderator, I want to give all of you an easy way to take charge of your own breast health. I mentioned Olivia Munn earlier, and back in March, she shed light on the value of risk assessment in determining your personal risk level for breast cancer as part of her own public story. Many of you know doctors use medical and technical versions to evaluate what age you should begin screening and what kind of breast cancer screening is best for you. But to provide a more patient-friendly way to begin to learn about risk factors, last year, Brem Foundation launched Checkmate, a quick online quiz, which will provide you with a list of your own personal risk factors for breast cancer on your phone, with conversation starters for your doctor at your next visit. It just takes a few minutes. It's just some basic questions. And the quiz ultimately arms you with information that empowers you so that when you go into your provider, you're prepared to take better care of yourself and to guide the conversation. So please take this quiz and share it with your loved ones. You can see the QR code there on the screen. And now, I am pleased to introduce Athena Jones. She's truly an accomplished and just impressive champion for breast cancer and cancer early detection. We were actually lucky enough to have Athena lead this program last year, and we're truly grateful, Athena, that you've returned this year. Athena Jones serves as CNN national correspondent based in New York City. She was formerly a CNN White House correspondent covering President Trump and his administration for all the network's programs and platforms. Athena has reported on politics and a wide range of topics and timely debates on issues of national significance. And as a two-time breast cancer survivor, Athena is incredibly generous with her story and experiences and uses them to help others. Welcome back, Athena.
Thank you, Claire. And hi, everyone. As you heard from Claire, I'm a journalist and a breast cancer survivor. I battled it twice in my 30s, even though I have no family history of the disease and no known genetic mutations. At the age of 36, I was diagnosed with extensive DCIS, so non-invasive cancer in the milk ducts. And at age 39, I was diagnosed with invasive cancer. So both diagnoses came before the age of 40, which is the recommended age to begin regular screenings. This is one reason why I'm so passionate about this topic. For the last few years, I've been working on a feature-length documentary on breast cancer called Sisters Keepers, with a specific focus on Black women who are twice as likely as white women to die of the disease before the age of 50 and have the highest death rate of it from any race. The film will also explore new ways to assess an individual's breast cancer risk that are more accurate across races. Since under commonly used traditional risk models, white women are 2 to 3 times more likely to be referred for supplemental screenings like MRIs that are covered by insurance than Black, Hispanic, and Asian women. So while my focus is on Black women, advancements in technology could help all women while allowing a shift from age-based screening to risk-based screening of women for breast cancer. So that's a little bit about me. I want to give you an overview of this event tonight. In a moment, we're going to be joined by our panelists to discuss how you can take charge of your breast health even before it's time to start mammograms. You'll learn about the importance of knowing your family history to determine when to begin screening and when to explore genetic testing. And you'll hear from inspiring breast health advocates and young survivors and get advice from experts. Now, there will be a Q&A at the end of the program, but you do not have to wait until the end. So if you have a question that pops into your head, please go ahead and share it in the Q&A box. You can add as many questions as you like, but you don't have to wait till the quick Q&A opens. And we'll encourage you to take a survey to help Brem make decisions about programming. That will happen at the end as well. And there'll be some fun prize giveaways, and you have to be present to win. So I look forward to this conversation. And it's now my pleasure to bring our incredible panel of experts and breast cancer advocates to the room. As we discussed earlier, cancer in young people is on the rise, with no exception for young women and breast cancer. Today, we're going to dig into what younger women and people of pre-screening age can do to best take care of their breast health, and learn from experts, young survivors, and advocates about how to use your voice to take care of yourself and loved ones. So joining us now, we have Dr. Margaret Hauser, the breast imaging radiologist and a BREM fellow at George Washington University Hospital. Welcome, Dr. Hauser.
Hi, everyone. Nice to meet you all. Thank you, Athena.
Next, we have I'm going to introduce everyone, and then we'll allow each one of you to give a fuller introduction. Next, we have Daria L. Ross, a patient and community impact advocate at Tiger Lily Foundation, and the Angel Lead Advocate for Southeast Michigan and National Coalition for Cancer Survivorship Elevate Ambassador. And we have Ali Rogan, a PBS NewsHour correspondent and author of Beat Breast Cancer Like a Boss. Ali and I worked together as producers in the NBC White House booth in the early years of the Obama administration. Perla Rodriguez is transitioning from service as a U.S. naval officer. She's an entrepreneur and a survivor thriver. And we'll have a special appearance by Cassie Ballou, Miss District of Columbia, USA 2023. So the current Miss District of Columbia and the communications director for Representative Eric Swalwell of California. So welcome, everyone. I want to kick off the conversation by giving each of these speakers I just gave a brief introduction a chance to introduce themselves more thoroughly and share a little bit about why they're here today. We'll have a chance to delve more deeply into the panelist stories during the panel. But let's start with you, Dr. Hauser, and maybe you can also give us a quick overview or preview of the actionable information you plan to share with everyone today. The floor is yours.
Sure. Sorry about that. Thank you for having me today. I'm so excited to be with you all tonight. Like Athena said, my name is Dr. Margaret Hauser. I'm one of the breast imaging fellows at the George Washington University here in DC. Some things that I'm so excited to talk to you all about tonight, since we are actually, most of us are under the age of 40 here. I'm excited to kind of share some things that we can do as young women who might be earlier than the recommended screening age as we kind of start our breast health journey. So some of those things, how do we do a breast self-exam? What does that look like? What are risk factors for developing breast cancer? How do I know if I have them? How should I know if I should actually be screened before age of 40? And also just kind of how to advocate for yourself when you do go to the doctor. What sorts of things should you be asking for, looking for? So I'm so excited to join you all for this conversation tonight.
Thank you, Dr. Hauser. Daria.
Hi, everyone. Thank you, Athena. I am Daria Ross, born and raised in Flint, Michigan. I live in Southeast Michigan. I'm in the area. I was diagnosed with stage 3 or stage 2, grade 3 triple negative breast cancer back in 2018. And I just celebrated my 5-year cancerversary on March 20th of this year. So I am thrilled, thankful, and feel incredibly blessed to reach that milestone. I love the mission of the BREM Foundation. I believe that we can really move the needle and make change when we educate people. I think education, being your own advocate, understanding those risk factors is empowering, and there's power in storytelling. And so any opportunity to educate people so that they can amplify their voices and really be an advocate for themselves, I support it wholeheartedly. So I'm thrilled to be here, and I cannot wait to really dig into this discussion.
Thank you for putting it so well. Of course, I agree. We all agree about the importance of this. Perla, go ahead.
Good evening, everyone. I'm Lieutenant Perla Rodriguez. I was diagnosed in 2018 as well, shortly after turning 26 with stage 2 ER/PR positive HER2 negative invasive ductal carcinoma. And I think one of the few things that I do want to bring up during this discussion is, the importance of self-advocacy, the importance of early detection, as well as the importance of knowing your own body and getting away from some of those stigmas that surround breast health and just general health amongst women.
Wonderful. And Ali.
Hi, everyone. Thanks for inviting me to be a part of this. So I represent the Previver delegation. I have not actually been diagnosed with breast cancer, but I found out at a very young age that I carried a mutation that increases a person's lifetime risk of breast cancer. I have the BRCA1 mutation, which I tested positive for when I was a junior in college. And as a senior, I had a prophylactic bilateral mastectomy with reconstructive surgery. And in a few years, I'll also be having an oophorectomy to remove my risk of ovarian cancer, which is also heightened with the BRCA mutation. So I'm here to talk about the genetic factors that do affect a lot of younger women who might not have begun their screening earlier, as well as if there's any questions about fertility. I know a lot about that as well. My husband and I did IVF. We did pre-implantation genetic testing, and our BRCA-free daughter, Anne, was born 18 months ago.
Thank you, Allie, and thank you, everyone. Let's dive in. Dr. Hauser, I'm going to start with you to kind of lay the groundwork for our discussion. Since younger women don't typically start mammograms until the age of 40, what can they do to look out for their breast health before then? And given that cancer in younger women is on the rise, does anyone need to start screening at an earlier age?
Yeah, so those are great questions. So actually, the first thing that everyone can do is actually starting at the age of 20 is we recommend starting doing self-exams. So what that means is actually picking a time every month to kind of do a self-exam at the same time every month. So whether that's the 1st of the month, the 15th of the month, pick a day, be consistent with it. And every month, just kind of feel what's normal for you. Start to know what your breast feels like normally, what they look like normally, so that if one month you feel something that's different, you'll be able to know that it's something that you should go and bring up to your doctor. So that's the first thing that women can start doing very early on, like I said, at the age of 20 years old. The next thing is just kind of knowing your risk factors for breast cancer. As you mentioned, the average risk woman should start screening every year at 40. But what if you are not at average risk and you're at an increased risk and you have to start coming earlier? So some things that actually do increase risk of breast cancer, first is just being a woman. 1 in 8 women actually will end up having breast cancer at some point in her lifetime. And then the second risk factor is actually aging. So, we have an increased risk of breast cancer as we age. But as we've kind of mentioned, there are so many younger women now before 40 who are being diagnosed with these aggressive breast cancers. Another risk factor that is important to know about is your family history. So if you do have first-degree relatives, so your mom, your sister, who have had breast cancer, we actually want to start seeing you for screening 10 years before that relative was diagnosed. So let's say your mom was 43 when she was diagnosed with breast cancer. We actually want to start screening you when you're 33. So it's really important to know, from both your mom's side and your dad's side, who in your family has had breast cancer. The other thing, which you actually won't end up knowing about until you actually go get that first mammogram, is your breast density. And basically what this is how much tissue do you have in your breast versus how much fat do you have in your breast. When we look at your mammogram, the connective breast tissue is actually white, but the problem is that breast cancer is white as well. So if you have dense breast tissue, meaning you have more white tissue on your mammogram, that actually makes it harder to detect breast cancer. And up to 50% of women have dense breasts. So it's really important to know if you are one of those 50% of people, because we actually will do extra screening for you, whether that's through ultrasounds, through MRIs, in addition to your annual mammogram. And actually having dense breast tissue increases your risk of breast cancer as well, up to 4 to 6 times. So it's really important to know and also to advocate for yourself to get that extra screening.
Thank you, Dr. Hauser. It's a lot of information to take in, but so important to be talking about. Daria, as we heard from Claire, breast health education is a key priority for the BREM Foundation. And Dr. Hauser just helped us better understand the importance of knowing your risk, understanding your family history. I know you're passionate about educating women about breast cancer. So tell me more about how you think we can make a difference through education, through events like this and talking about it.
Absolutely. So I think that we have to start younger. We've heard the statistics. We've got this data this evening. We know that women are getting diagnosed at younger and younger ages. So I think understanding your breast health at an early age is essential. I had the opportunity in February for Black History Month to go to Detroit Renaissance High School and talk to some teenagers. They had a health fair, and it was incredible. And these young people were engaged, they were vibrant, they were able to tell me what a clinical trial is. And I just believe that that experience is a testimony to how effective education can be. We're talking about understanding our health in this manner in our 20s, but I say we can do it at high school age. Teach people how to check their breast, understanding what a breast exam is, understanding how to do a self-exam. You know, we're using a lot of terms today that those of us who are survivors, thrivers, caregivers in the community, Dr. Hauser explained what dense breasts were. Most Black women and women of color have dense breasts, but the vast majority in certain populations don't know what dense breasts are. And in most cases, they don't even want to ask. So if we can create fun, welcoming environments where people feel engaged and empowered and comfortable talking about their health and asking those questions, I think that it will be very effective. And that's a good starting point.
I agree. I want to jump around a little bit and dig in more to the issue of family history and genetics, and spend some more time discussing that. I want to hear from each of the panelists about those particular risk factors. You know, most people are surprised to know that over 75% of women who are diagnosed with breast cancer don't have a family history. That was the case with me. But we know that, as we heard from Dr. Hauser, family history of breast cancer and of some other cancers increases your chance of getting breast cancer significantly. In some cases, people have a known genetic mutation, like Ali spoke about, that carries an even higher risk and demands action. I want to start with Dr. Hauser again to give us an overview of how family history of breast cancer and genetics can affect an individual woman's breast cancer risk. And also, Dr. Hauser, when should someone consider genetic testing or consider speaking to a genetic counselor?
Sure. So like you said, up to 75% of women who have breast cancer actually won't have a family history, which I find a lot of people actually are really, really surprised to know, that, you know, so many women are affected who don't have relatives who have had breast cancer. It's really important to ask both your mom and your dad, to have their family histories as well, because also another thing is that breast cancer can actually come from either side of your family, not just from your mom's side. So you want to ask both of your parents, start there with, you know, what, you know, their parents, their brothers, their sisters, cousins, what kinds of cancer have all of your family members had, not just breast cancer, but prostate cancer, ovarian cancer. All of these different kinds of cancers can all be tied together with some of these genetic mutations. So having a full idea of your family history is really important to bring to your doctor. You asked, you know, when can someone think about potentially getting tested for one of these genetic mutations? And the answer to that is, if the more first-degree relatives you have who have cancer, again, not just necessarily breast cancer, but any cancer, should kind of flag that maybe you should get tested. So first-degree relatives, meaning your mom, your sister, you know, people like that. The more family members you have, the good idea that it is to go get genetic testing. You know, there's also lots of genetic tests to consider. So we do have BRCA1, BRCA2, but there's over, you know, 70 different genes that actually carry these risks of breast cancer. And if you carry some of these genes, we may even start seeing you as early as 25 years old. So it's really important that if you think that you might have one of these genetic mutations, to get tested, ask your doctor about it. And the great thing is that it used to be really inaccessible, being thousands of dollars to get tested, and now it's so much more accessible to women, being a few hundred instead of a few thousand. So now it's much more accessible.
Thank you. I want to hear from the rest of the panel about family history and genetics, and it makes sense to start with Allie. You're the previvor. Talk about more about your journey more and the role that understanding genetics played for you. You mentioned it a little bit in your introduction, but what do you most want people to understand about the risk factors you faced?
Yeah, to underscore what Dr. Hauser said, I inherited my BRCA mutation from my dad's side. Breast and ovarian cancer ran very strongly in his family, but the reason he got the BRCA test was because his sister had ovarian cancer. So again, many of these mutations carry risks of a variety of cancer. In fact, my dad, there is a link between BRCA and prostate cancer. I believe it's higher for BRCA1. And my dad is a prostate cancer survivor, so that's another part of it. I chose to have a prophylactic mastectomy very, very early. I did it before I graduated college, and that was really something that was based on personal choice, but this was back in 2009. And when I went to see my doctor then, I was informed that more and more young women were getting this done because the thought was, why wait? What am I waiting around for? But I would say that that's a deeply personal choice, and certainly prophylactic surgery is not the only option available. There's also earlier surveillance, alternating MRIs and mammograms. Another thing I would say is that, as Dr. Hauser was saying, the importance of beginning that surveillance at an earlier age, if there is a history of it in your family. My cousin, so the aunt who passed cancer, one of her daughters did have breast cancer in her 30s. And so even if I hadn't got the prophylactic mastectomy, it would have been appropriate for me to start screening 10 years prior to that, which I absolutely would have done. The last thing I'll say is in terms of passing on that mutation. Well, first of all, I do have a brother who is married and wants to start a family, and he's going to do genetic testing before they start a family to make decisions about how far they want to go in preventing that from the next generation. My husband and I actually had undiagnosed infertility, so the opportunity to do genetic testing on the resulting embryos that we fertilized was an ancillary benefit. I don't know that we would have done it if not for our infertility issues. I had to do 4 rounds of IVF to get enough embryos to have what my doctor said was a good chance of having 2 children, which was our ultimate goal. But the benefit of that is, you can test for BRCA, but my first round of IVF, all of the embryos that we fertilized that were otherwise chromosomally normal had the BRCA gene. So it is an added factor, but it's something that really there are tremendous options available to know your risk, know your family history, know your genetic risk, and also understand what your options are for stopping it with your generation.
Thank you, Allie. Perla, can you weigh in here? How does your family history play into your story with breast cancer?
Absolutely, yes. So my family history was a little bit interesting to learn about as I was going through, I guess, the beginning of my journey. I knew that my grandmothers had passed away from different types of cancer, not necessarily breast cancer. So I knew that cancers ran in the family, but I actually didn't find out that I had aunts on my father's side who had breast cancer until after I was diagnosed. And that kind of plays into what I mentioned earlier, those stigmas around breast cancer. So they were ashamed to talk about it. It wasn't something that they really wanted to put out there. So that kind of leads into not being ashamed of it so that you can let your family know and everybody can be aware of what their risks really are when it comes to it. Now, I'm not saying that knowing about their risk or the fact that they've had it would have lowered my risk, but at least it would have been something to know once I started. And then 2 years after I was diagnosed, my older sister was actually diagnosed as well. She was diagnosed in her early 40s. So that's kind of like that first, degree relative that was diagnosed after me. But it is important to know your risks, as you mentioned, know who's had it. So I know my sister and I have made it a point to really put it out there that we have been diagnosed so that all of our relatives are aware. And once I was diagnosed, I did do a 14 gene panel test, and they all came back negative. So I don't know if it's, you know, something along those lines, and we just don't know which one it is yet, but we're working on finding out slowly.
Thank you. Excuse me. Daria, tell us about your breast cancer journey and whether family and family history and genetics played a role in your story, and talk about how you speak to others about these risk factors.
Absolutely. So it's so interesting, you know, as I hear the conversation, I think a lot of the way that I approached my experience is just my personality. When I got sick, I didn't know anything about breast cancer really. So I just had to dive in. And once I started learning what the inequities and the disparities were, and that my subtype, I didn't even know breast cancer had subtypes. I'd seen the commercials for HER2 positive, negative, and so forth, but it didn't register with me because it wasn't affecting me. So once I figured all of that out and understood what that was, I started researching everything, and I saw that disproportionately Black women were being affected. So I did research. I found doctors that were really big in the community. I emailed them. Am I doing everything right? Is this what I should be doing? And one of the things they said was make sure you do your genetic testing. And so I did that. And I don't have the BRCA gene. It was a great experience because it allowed me to talk to my father and my mother and learn more about the family history on both sides. I am in that 75% that didn't have, you know, a family history. So I was completely confused and perplexed because I was healthy. I wasn't a smoker. I wasn't a drinker. I was living in New York City. I'd sold my car. I walked everywhere. So, you know, I would walk to the park to meet my trainer, you know, so it just seemed so shocking. But I think a big part of this, you know, I'm hearing a lot about fertility treatment and the if you have a family history. I have two nieces that are 6 and 10 years old, and I have a sister, I have a mother, I have brothers. I think that it is really important and critical to do that genetic testing. But when I think about the more vulnerable populations, we've just got to get them screening. And then we can talk about doing the advanced 10 years. You know, we've got to get people in the room. And when you think about a community like Flint, they've been affected by the economic downturn. They've been affected by the water crisis. We're going on 10 years now that Flint has been dealing with the water crisis. And then you add the pandemic. All of those factors have diminished the screenings and the proactive approach to your health. And if we want to improve those outcomes, it's environments like this where people can join, listen, hear, learn, and be empowered to ask those questions. And I think it is especially important that people approach how they deal with their care team differently. You need to look at your doctor as a collaborator and someone that you can partner with. It doesn't have to be adversarial. And for many, many communities, that's just not how they approach their doctors. They go into a room, they're afraid to ask questions, they're intimidated. We have to change that narrative. And I tell anyone that I support as I advocate, I talk to a lot of women once they're diagnosed, I talk them through it. I tell them my experience because everyone has a nuanced experience. But in that, I say, you need to be empowered. You need your agency. And the way you do that is you are educating yourself, you get informed. I'm sure Dr. Hauser can tell you, and any doctor will say, an informed patient is a good patient because then you go in that room, you know what you're dealing with, you're able to make decisions, and you don't have someone else making those decisions for you down the road. So I think all of this is so important. But when I'm thinking about those vulnerable populations, I think we have to start at the baseline, the basics, educating them and getting them comfortable to just talk about their health.
I so agree. I think both you and Perla talked about the importance of getting comfortable talking about it, and what Allie did, how she approached her her diagnosis of learning about BRCA1 and 2 is so brave. And it's just important for everyone to see the different faces and ages and races of breast cancer and how, every kind of woman is affected. I want to get one more question in for everyone. If you give brief responses, we can cover this. And that's the part about using your voice. It's what we're doing here tonight. We frequently hear that young women with breast cancer, particularly women of color, can be dismissed when they find a lump or have breast pain or experience another abnormality. Frequently turned away from care, they're told they're too young, or often treated for other conditions, wasting precious time when early detection could have resulted in a better outcome. Each of you on this panel is using your voice as influential breast cancer advocates to educate people, to empower people, to hopefully get them talking about this beyond this session. So I want each of you to respond on this question. Perla, I'll start with you. Can you share the story? You shared a little bit already of your diagnosis, but the challenges you faced in getting care and the advice and the treatment you needed. And I'm sorry if you can keep it somewhat brief. Thanks.
Absolutely, I'll try to keep it brief. So I was on a ship in the Navy when I first detected my lump. I found it myself, and I had to go through someone in order to get an appointment scheduled to be seen once I got back to shore. Long story short, I had to request that appointment about 3 or 4 times. Eventually, talk straight to him and say, "Hey, I understand I'm 25 years old, you might not be concerned, but I'm concerned. So let's go ahead and get this appointment scheduled so I can be seen when I get back on land." So I got over that hurdle, but then ran into the hurdle of, well, the first appointment, they just kind of palpated. They're like, "Oh, well, I guess you do have a lump, but you're too young. It's probably nothing. I guess we'll go ahead and schedule you for an ultrasound, wait a few more weeks, get seen for that ultrasound." Same thing, we see something, it's probably nothing, you're too young for this. I let them know I was about to deploy with the Navy, and that is probably what saved me, because they said, based on you going out to sea in a couple of weeks, we'll go ahead and give you that biopsy. Normally we'd, let it sit, see you again in 6-ish months and reassess. But since you're going out to sea, we'll give you that peace of mind. Finally got that biopsy a few weeks later. And again, as they held my hand while they biopsied me, they told me it was probably nothing. I was too young. I had nothing to worry about. A week later, I got that phone call and was told I was diagnosed with breast cancer. The day of my double mastectomy, that radiologist came in and apologized to me for saying those things to me, which I thought was a very big thing to do. And I understand they're trying to give you that peace of mind as you're going through it, but it is at the same time a little invalidating, because I just wanted that diagnosis. I felt it in my soul, but I just really wanted diagnosis. And that was one of the first hurdles I ran into. It was just getting that diagnosis. And the next big one, based on being a woman or based on the age, was getting recommendations from my first plastic surgeon on what surgery I should get. He barged into the room, this big burly man in, Navy medicine, asked me what I wanted. I had absolutely no idea, because that's what I thought I was there for him to, give me those recommendations. Ultimately, he ended with, "Look, you just need to worry about getting rid of the cancer, and you can worry about the reconstruction later." And that led into this spiral of, I was flat for 2 years based on that recommendation. I lost the option for implants. I had to go with the deep flap reconstruction, which my new plastic surgeon did a fantastic job on, but it has led to a lot of issues, both internally and externally. So long story short, I did run into a lot of hurdles, from "you're too young for this" to "you're being superficial and caring about the type of reconstruction you're going to have. Just worry about getting rid of the cancer." So that's where our voice really needs to come in. As Daria mentioned, an informed patient is a good patient, and we can do all we can to be informed, but a doctor that informs is also very important. So it's having that balance and being able to stand up and use your voice in those moments, because I really wish I had. I feel like I would have saved a lot of heartache.
Well, certainly, but you also use your voice in order to get diagnosed, and that is so important. And just like Daria said about the doctor as collaborator, not as adversary, like the second doctor you dealt with was not as, not as receptive. This is also important. But Daria, I want to talk to you again about this, about the impact you're having by speaking openly about the hurdles Black women and other marginalized groups face in speaking up or in advocating and getting the medical care they need. How is your work as an angel lead with the Tiger Lily Foundation helping to deal with these issues? If you could answer relatively briefly.
Okay, I'll try to keep it brief because Perla hit so many points and she is not an anomaly. I was diagnosed in my mid 40s. So I didn't have that issue, but I did experience some dismissiveness from my initial radiation oncologist. Um, I'm triple negative and I don't know what to do yet. Should I have radiation? In hindsight, of course I should have radiation. But he looked at me and told me that he didn't recall being on my tumor board review. Even if it was a year ago, did you look at my chart before you met with me? And he said, some women are concerned about side effects, some are concerned about a recurrence. What I know in hindsight is that he should have said to me, yes, you should do radiation. You must do radiation. And that's what I was looking for him to tell me. I had enough agency to say, this won't be my doctor. And I found a lovely, wonderful radiation oncologist who was very present and engaging. The Tiger Lily Foundation changed my life. In short, they changed my life. I didn't know that there were cancer advocacy organizations that spoke to young women, Black women, brown women, and that was the focus. I did not know that. They literally slid into my DMs. I had just been sharing my story on socials for my healing, and I also felt like sharing that could be helpful to others. And when they approached me and said, would you like to become an angel advocate? I said, absolutely. It allowed me to elevate my awareness, my understanding. I was able to further educate myself, and I really got the necessary tools to take my advocacy to the next level. And I think that is really, really critical. Short, very quick, brief story. My plastic surgeon felt like the infectious disease team at my teaching hospital were alarming me because I caught an infection after my bilateral mastectomy a month later. And you're in these teaching hospitals and they come in and they give you soup to nuts, the worst case scenario. And so when my plastic surgeon came in, he thought that the infectious disease team had really scared me. And I looked at him and I said, I'm not afraid. They just gave me all of the information, doctor. It's up to me to make that decision. Let's take this expander out. Let's clean the area out and start over. If my body rejects it, we move on. And that gentleman looked at me and he is an intimidating figure. And he said, all right, I'll be here in the morning. And so that's my point. If you are empowered and you know what you want as a patient, and in order for you to do that, you have to be educated, doctors respect that. And if it's a doctor that doesn't, then you have to change. That's not the doctor for you. That is not the lid for your pot. But I think a good doctor will respect that. They welcome it. They want to work with you. They want to fulfill your needs. And I think, again, it starts with education and learning how to use your voice. And that's an example of how I did that, Athena.
Thank you, Daria. And Allie, we heard your story about BRCA 1 and 2 and in your advocacy and taking action at a very young age. Explain what you learned from the women you interviewed in Beat Breast Cancer Like a Boss. What were some of your main takeaways when you wrote that book?
Yeah, so I wrote that book. It came out in 2020, inspired by my own struggle with feeling like there wasn't a collection of stories of survivorship and going through and all the way through to metastatic thrivers. And I wrote it and I interviewed Miss Athena here. So it's available wherever books are sold. Her story is really, really inspiring. But to echo what everybody else has said to this question so far, being your own best advocate is the most important tool in your toolbox. Edie Falco, a very famous actress, felt like nobody was speaking to her in plain English, and so she literally had to say that again to me in plain English. I had young women who felt like they really had to muster all of the confidence in their bodies, and some of them actually did bring, and I think actually, Athena, this you might have done this at some point in your journey, but bring somebody else.
Yes.
Just to make sure that there's like a witness and somebody to,
Note
you
taker?
know, yeah, to take notes, to follow up if maybe it looks like, you know, their friends missed something and they know you're going to want to follow up on. That can be very helpful, especially for younger women. And the way I kind of sum it up in terms of being your best advocate, and I say this is not meant to be taken at face, you know, literally, but embrace your inner Karen, right? Like, you are entitled to this good care. Like, you know, you deserve it. So be obnoxious if you have to, you know, speak to the manager, because this is your health and these are people who are there to make you better. And if you don't feel like they're fulfilling that responsibility, you are completely within your rights to demand better.
Hear, hear. Dr. Hauser, you are seeing patients every day and you're educating people about breast health in sessions like this. How do you teach women to self-advocate and play an active role in getting the care they need and deserve? It can be a lot to confront this. You're already dealing with a diagnosis, and then you have to deal with maybe a doctor who isn't as forthcoming as you'd like or is being dismissive. What is your advice?
For sure. So what everyone just said was just all so amazing. I mean, you know, Perla, to your story, like the fact that you're so young when you were diagnosed and you were just kind of advocating for yourself to get that biopsy, like that's exactly what we need because you know, yes, we see a lot of patients, we see a lot of young patients, and most of them are fine, but some of them aren't. And you know your body best. You know that this doesn't feel right for me, something's wrong. And if you know that about you, you're the only one who knows that about you. You know, take yourself to another doctor if they're not going to do it for you. You know something's up, so go get it checked out. I think that is, you know, just so important to just kind of, you know, advocate for yourself. Um, and, you know, doctors will listen when you are sure, when you say, no, this is not right for me, I need something, you know, we want to help you.
Thank you, Dr. Hazard. Thank you to all the panelists. We're not finished, of course. We're going on to the fun part that I mentioned earlier. The Bren Foundation is giving away gift cards to 5 lucky attendees. And to help announce the winners, I'd like to invite Cassie Ballou to join us. Cassie, as we mentioned earlier, I believe was Miss District of Columbia, USA 2023, and is Communications Director for Congressman Eric Swalwell from California. She has devoted her service work this year to cancer advocacy. So welcome, Cassie.
Hi, thank you so much for having me. I'm so happy to be here speaking with you all. I've had the privilege of getting to know the Bren Foundation in 2022 when I was advocating for the Find It Early Act in the US House of Representatives. And I really use my platform as Miss DC USA to promote cancer awareness and discuss how to support caregivers. My mother is a breast cancer survivor and a cancer survivor. So my focus is really on to eliminate stigmas around breast health and early detection and hope to empower more women to speak about how they can seek help from their healthcare providers. I think it's really important that we normalize terms like breast health education and teach more women, especially women in my age group, you know, how to do self-exams. And learning more about the definitions of our health, particularly terms like dense breast. And I know this was previously mentioned, but particularly in the minority and immigrant communities, I think we need more visibility. As a daughter of an immigrant, I know how my mother really struggled with her diagnoses. And because she grew up in a culture where talking about your health was not normal or understanding the importance of what that could mean for helping potential diagnoses for future generations was just a new thing for her and something that she tried to eliminate the cycle when it came to me and the rest of my siblings. So I'm incredibly thankful to her and her strength, and thankfully she is stronger than cancer and is in a place of recovery. But for the women who are not so lucky, I believe that discussions like this are so important because they save lives and they teach people about education and the importance of early detection. And if I could leave all of you with something this evening. This is my favorite quote. It is, "Survivors are the lens through which others see hope." So I hope that is something that can give everyone some peace and some hope moving forward. And on to fun, exciting things like gift cards courtesy of the Brem Foundation. I have the winners. This is a drum roll. So to Shannon, please forgive me if I mispronounce names. Sharon, excuse me, Typert, congratulations. You've won a $30 Lyft gift card. So congratulations, Sharon. To Anna Espisha, a $30 Aerie gift card. Congratulations, Anna. To Kay Stevens, a $30 gift card to Aerie. Congratulations. And Lexi Elliott, also a $30 gift card to Aries as well. And Thelma D. Jones, a $30 gift card for Lyft. So congratulations, everyone. I hope this is something to brighten up your day. And thank you again for having me on.
Thank you, Cassie, and congratulations to the winners. So moving on to the Q&A, we have a couple of questions here. The first is, I believe this is directed at towards Dr. Hauser, but anyone else who wants to chime in afterwards. What besides mammograms or self-exams is recommended if you have dense tissue? When do you advocate for that extra test? And I think this can be combined. So when to advocate for that extra test, what other tests to do? And do they say a mammogram isn't worth the radiation if you're dense? Should you do an ultrasound instead? Dr. Hauser?
Yeah, so those are all great questions. So first, I want to start with, are mammograms worth the radiation? The answer is yes. Even if you have dense breast tissue, we always want everyone to get their mammogram every year. And the reason for that is that there are some types of breast cancer that we can, which is actually a lot of times early, very curable breast cancers that are only seen on mammogram. They're not seen on other imaging modalities. So even if you have dense breast tissue, we always want you to get that mammogram as well. Ultrasounds are other modalities that we can use, as well as MRIs. The addition of one of those two tests to your yearly mammogram can help us detect cancers in patients with dense breasts. And when for advocating for that extra test. So your mammogram report will always have your breast density on it. So when you get your mammogram report back, you will know if you have dense breast tissue. And you can call the number of the imaging facility that you went to get that extra test scheduled. Ask for either an ultrasound or an MRI, because I have dense breasts, so I want it for extra screening. That's what a lot of our patients at GW do.
Thank you. The other question we have is, does it make sense to have the genetic testing after a breast cancer diagnosis? This Kay Stevens says, I was referred to a genetics counselor, and based on my family history of cancer, not breast cancer, I was told I qualify for genetic testing. So I guess talk a little bit more about genetic testing and when it makes sense to have it.
Yeah, sure. So it does make sense to have it after a breast cancer diagnosis. You want to make sure that basically if you have any of these genetic mutations, they test you for many of them. You can be at risk for not just breast cancer, but other other types of cancer as well, whether that's ovarian, lots of other types of cancer. So it's good information to know, but also not just for you, but for all your family members as well. So you can pass, that genetic mutation onto your children, brothers, sisters, moms, dads, everyone will want to get tested, because that will affect their screening, not just for breast cancer, but like I said, other cancers as well. So we always recommend that anyone with, with a known diagnosis of cancer get genetic testing.
Wonderful. And this is another question for Dr. Hauser. This makes sense. People want to ask the expert. Dr. Hauser, if you have multiple family members with breast cancer on both sides, including the mother, is hormone HRT, I believe that's hormone therapy, completely out of the question?
So there are some types of hormone replacement therapy that can increase your risk for breast cancer. So I'm not sure in regards to what type of hormone replacement therapy the question is in regard to, but I would, talk to your doctor about your family history of breast cancer as well as what type of therapy you're thinking about, because you're probably already at an increased risk for breast cancer, and some sorts of hormone replacement therapy can further increase that risk.
Great. Well, I believe that's all the time we have. I want to thank our panelists again. I could talk about this all night, and of course every year. And I want to pass this on to Claire Doherty to come back to the screen to give closing remarks. Thank you all again for sharing your stories and for sharing your voices. And I hope you'll continue spreading the word. Welcome, Claire.
Well, I'm really just blown away by this fantastic panel that we've had tonight. And I just want to really offer my thanks to all of you, as well as to Athena and Cassie for this great conversation. I want to give everybody here 3 quick takeaways to take charge of your breast health and to join Brum Foundation in driving early detection of breast cancer. So the first one is take Checkmate. I talked about that earlier. It's a very quick and easy breast cancer risk quiz, and share it with your loved ones. And if you weren't able to grab it earlier, we could put a link in the chat, and we also go to brumfoundation.org to learn more about it. Second, get involved with the Brum Foundation. We want you with us as a champion for breast health, and there are many ways that you can be an agent for better health outcomes. So please join us. Finally, take care of yourself and your loved ones. Practice the monthly self-exams that Dr. Hauser talked about. Know your normal, learn about your family history, and talk to a doctor about when you need to begin screening based on your personal risk factors. Get the breast care and the care that you need. Thank you so much. We appreciate this fantastic dialogue, and Brum Foundation is really grateful to all of our panelists.